Your body has a system, a very specific, very deliberate system. And when that system gets activated, but never finished, something happens inside, something real, something measurable, something science actually has a name for. Let us explain exactly what is going on. When arousal begins, the nervous system sends an immediate signal, specifically the parasympathetic branch. That signal does one thing. It dilates blood vessels in the pelvic region. Blood rushes in fast, faster than the body can drain it out. This is not a mistake. This is intentional. The body is preparing for something. In males, the testicles can increase in size by up to 50%. The epididymis fills with fluid. The prostate activates. The seminal vesicles begin secreting. Everything is loaded. Everything is waiting. In females, the same mechanism activates. The clitoris, the labia, and the vaginal walls all fill with blood. The uterus shifts position. Blood flow increases throughout the pelvis. Both systems, same process, same purpose. Normally, this system gets a release. Muscle contractions fire. Fluid is expelled. Blood vessels return to normal. The parasympathetic signal winds down. Everything drains. Everything resets. But what if that release never comes? If arousal stays elevated for 20, 30, 60 minutes or more, the blood does not leave, the fluid does not leave, and the body starts to feel it. In males, this condition has an actual clinical name: epididymal hypertension. In females, it is referred to as pelvic congestion, and the discomfort comes from multiple simultaneous sources, which is why it can feel surprisingly intense. Source 1: vascular congestion. The small veins in the tissue remain compressed under pressure. Arterial blood keeps flowing in, but there is nowhere to drain. The tissue is caught between incoming pressure and a blocked exit. Source 2: muscle tension. A small muscle called the cremaster stays partially contracted during arousal. Its job is to raise and lower the testicles, but hold any muscle in sustained contraction, and it aches. The cremaster is no different. Source 3: ductal pressure. The vas deferens and epididymis fill with secretions: sperm, seminal fluid, prostatic secretions. All of it loaded, none of it going anywhere. That pressure radiates as a deep, dull ache into the lower abdomen. In females, the sensation is similar: a heavy, throbbing, persistent aching in the pelvis. Less talked about, less named. But the underlying physiology is nearly identical. Nothing actually turns blue. But the name is not completely made up either. In prolonged congestion, pooled venous blood becomes more deoxygenated over time. Deoxygenated blood is darker. In extreme cases, tissue can take on a slightly dusky hue. That is exactly where the name comes from. But in practice, the effect is so subtle, it is essentially invisible. One side has a catchy nickname and decades of jokes. The other side is largely invisible in public conversation. The science on both sides is real and nearly identical. One important note: any testicular pain that is severe, sudden, or does not resolve, especially if accompanied by nausea, vomiting, or one testicle sitting noticeably higher than the other, should be evaluated immediately. This could be testicular torsion, a mechanical twisting of the spermatic cord that cuts off blood supply entirely. Unlike the condition we just described, torsion is a surgical emergency. Every minute matters. If something feels wrong, do not wait. So here is what we know. This is real. It has clinical names. It involves multiple physiological mechanisms. It happens in both males and females. and it resolves on its own. It is one of those topics that sounds like a joke until you look at the actual science. And the actual science is genuinely fascinating. If you want to understand more about how the human body works at its deepest level, subscribe, because we are just getting started.